Hemorrhoids are an incredibly common condition that affects millions of people and can cause significant discomfort. If you've ever experienced them, you know how uncomfortable and disruptive they can be. For those who might not be familiar, hemorrhoids are swollen blood vessels in the rectal or anal area that can cause pain, itching, and other symptoms. In this video, we'll cover everything you need to know about hemorrhoids, including their symptoms, how they're diagnosed, and most importantly, how they can be managed effectively. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. Hemorrhoids, sometimes referred to as piles, are swollen veins located in the lower rectum or anus. They are similar to varicose veins that you might see in the legs, but occur in a much more sensitive area. Hemorrhoids can be classified into two main types, internal and external. Internal hemorrhoids are found inside the rectum and are typically painless because the area lacks nerve endings that sense pain. However, they can cause bleeding, especially during bowel movements. In some cases, internal hemorrhoids may prolapse, meaning they extend out of the anus. External hemorrhoids, on the other hand, occur under the skin around the anus. Because this area is rich in nerve endings, external hemorrhoids can be quite painful, especially if they develop a clot, a condition known as a thrombosed hemorrhoid. This can cause significant discomfort and swelling. Hemorrhoids develop when there's increased pressure on the veins in the rectal or anal area. This pressure can be caused by several factors, including straining during bowel movements, prolonged sitting, chronic constipation or diarrhea, and heavy lifting. Pregnancy is another common cause because the growing uterus puts pressure on the veins in the pelvic region. Age can also be a contributing factor. As we get older, the tissues supporting the veins in the rectum and anus can weaken, making hemorrhoids more likely. Lifestyle factors such as a low-fiber diet and insufficient physical activity can also increase the risk. The symptoms of hemorrhoids can vary depending on the type and severity. For many people, the first sign of hemorrhoids is rectal bleeding, often noticed as bright red blood on toilet paper or in the toilet bowl after a bowel movement. This is especially common with internal hemorrhoids. Internal hemorrhoids that prolapse may cause a sensation of fullness or a lump at the anus. These hemorrhoids can sometimes be gently pushed back inside, but they may cause discomfort or irritation if they remain prolapsed. External hemorrhoids, on the other hand, are often associated with symptoms like pain, swelling, and itching around the anus. If a blood clot forms, the pain can become sharp and severe, and the area may feel hard to the touch. If you suspect you have hemorrhoids, it's important to see your doctor for an accurate diagnosis. While hemorrhoids are common, other conditions such as anal fissures, abscesses, or even colorectal cancer can cause similar symptoms. Your doctor will typically begin by asking about your symptoms and medical history. They may perform a physical examination to assess the anal area. If internal hemorrhoids are suspected, a digital rectal exam may be conducted. During this exam, the doctor gently inserts a gloved, lubricated finger into the rectum to check for abnormalities. An anoscope, a small tube-like instrument with a light, may be used to examine the lower rectum and anal canal. For individuals with more severe symptoms or a history of rectal bleeding, additional tests like a sigmoidoscopy or colonoscopy may be recommended to rule out other conditions. Now let's discuss how hemorrhoids are managed. The good news is that in most cases, hemorrhoids can be treated effectively with the combination of lifestyle changes, home remedies, and if necessary, medical interventions. For mild hemorrhoids, lifestyle changes are often the first line of defense. Increasing your dietary fiber intake is one of the most important steps you can take. Fiber helps soften stools and promotes regular bowel movements, reducing the need to strain. Foods like fruits, vegetables, whole grains, and legumes are excellent sources of fiber. If it's challenging to get enough fiber from your diet alone, over-the-counter fiber supplements like psyllium or methylcellulose can be helpful. It's recommended to get at least 20 grams of fiber a day. Staying hydrated is equally important. Drinking plenty of water throughout the day helps keep stools soft and easier to pass. Regular physical activity can also promote healthy bowel function and improve circulation, reducing the risk of hemorrhoids. Avoiding prolonged sitting, especially on the toilet, can prevent excess pressure on the rectal veins. If you find yourself spending a lot of time in the bathroom, consider adjusting your habits to reduce this strain. For immediate relief of symptoms, several home remedies can be effective. Warm sitz baths, where you soak the anal area in warm water for 10 to 15 minutes, can help reduce pain and inflammation. You can do this several times a day, especially after bowel movements. Over-the-counter creams, ointments, and suppositories containing ingredients like hydrocortisone or witch hazel can also provide temporary relief from itching and irritation. If your symptoms persist despite these measures, medical treatment may be necessary. Minimally invasive procedures are often used for more severe hemorrhoids. Rubber band ligation, for example, involves placing a small rubber band around the base of the hemorrhoid to cut off its blood supply. The hemorrhoid eventually shrinks and falls off within a few days. Another option is sclerotherapy, where a chemical solution is injected into the hemorrhoid, causing it to shrink. Infrared coagulation, which uses heat to shrink the hemorrhoid, is another minimally invasive technique. For large or prolapse hemorrhoids that don't respond to other treatments, surgery may be required. Hemorrhoidectomy, the surgical removal of hemorrhoids, is highly effective but comes with a longer recovery time. A newer procedure called stapled hemorrhoidopexy is less invasive and involves repositioning the hemorrhoid tissue while reducing blood flow to the area. I just want to take a moment to ask that you hit that like button if you find this information useful and subscribe to my channel. Leave a comment below if you know any home remedies for relief of hemorrhoids. Anyway, preventing hemorrhoids is often easier than treating them. Making simple adjustments to your lifestyle can significantly reduce your risk. A high-fiber diet, adequate hydration, and regular exercise are foundational. Establishing healthy bowel habits is also important. When you feel the urge to have a bowel movement, don't delay, as waiting can make stools harder and more difficult to pass. Avoid straining during bowel movements and consider using a footstool to elevate your feet while on the toilet. This position helps align your rectum for easier elimination. Managing stress and avoiding heavy lifting can also help prevent excess pressure on the rectal veins. While hemorrhoids are usually not serious, there are situations where you should seek medical attention. If you experience significant rectal bleeding, severe pain, or notice a lump that doesn't improve with home treatments, it's important to see your doctor. Additionally, if you have a family history of colorectal cancer or over the age of 45, rectal bleeding should always be evaluated to rule out more serious conditions. Hemorrhoids may be a sensitive topic, but they're nothing to be embarrassed about. They're a common condition that many people experience, and there are effective ways to manage and prevent them. Understanding the symptoms, seeking proper diagnosis, and following a tailored treatment plan can help you find relief and improve your quality of life. Thank you for watching. I hope you found this video useful. As always, take care of yourself and make the most of your day.